Kidney dialysis is a treatment for kidney failure, also called end-stage renal disease, ESRD. It is a procedure to remove waste products and excess fluid from the blood when the kidneys stop working properly. Dialysis is necessary when chronic kidney disease reaches an advanced stage and the kidneys are no longer able to function at a level that is sufficient for day-to-day life. Steps of dialysis treatment. Hemodialysis and peritoneal dialysis are the two major types of dialysis treatment. Before dialysis, the patient is weighed to determine if they are over their target weight, which could mean they have too much fluid built up. Vital signs, including blood pressure, temperature, and pulse, are taken. The access site is cleaned and checked to make sure it is functioning. This access can be through a catheter, graft, or fistula. Connecting to the machine. The patient is connected to the dialysis machine through their access site, allowing their blood to flow out of their body and into the dialyzer or artificial kidney. An anticoagulant medication called heparin is administered into the blood to prevent clotting. Starting and monitoring dialysis. The dialysis machine pumps blood through the dialyzer to filter out waste and excess fluid at a controlled flow rate and temperature. During the treatment, which can last 3 to 6 hours per session, electrolytes, blood pressure, and comfort level are closely monitored. Disconnecting and post-care. Medications, fluid removal rates, or other settings may be adjusted. The patient is disconnected from the machine once the treatment is complete. Vital signs will be checked before the patient leaves. The site must be monitored for bleeding or infection after treatment. Patients typically need 3 dialysis treatments per week, with each lasting 3 to 6 hours depending on the modality and prescription. Dietary and fluid intake restrictions are also part of managing kidney failure with dialysis. Types of dialysis. There are 2 primary types of dialysis: hemodialysis and peritoneal dialysis. Hemodialysis uses an artificial kidney called a dialyzer to filter waste products, extra salt, and water from the blood. It relies on diffusion, osmosis, and ultrafiltration to clean the blood. Peritoneal dialysis uses the lining of the abdomen to filter blood. A cleansing liquid called dialysate is introduced into the abdomen via a catheter. The walls of the peritoneum act as a semi-permeable membrane to remove waste and excess fluids. Pros and cons of dialysis. Dialysis is an imperfect treatment that keeps patients alive, but has disadvantages. Survival rates on dialysis. The prognosis for dialysis patients varies substantially depending on their age, health status, and comorbid conditions. Emerging future options for kidney failure treatment. While innovations in dialysis are extending and improving quality of life for kidney patients, there is extensive research underway to develop alternative therapies and possibly even regenerative options to delay or avoid the need for dialysis altogether.